I know we are still in the middle of the pandemic and still fighting it at such a large scale across the world. But I think what we are seeing right now is just tip of the iceberg, because we are more or less right now just more occupied with fighting with the virus and the pandemic that is there. But I think a bigger tsunami is there to hit us once all this settles up, because that's what we see when we look at the social impacts of COVID. And I think some way or the other, we need to start preparing for it now, because this is an eventuality that will strike us. This is not something that we can, or somehow we would wish to, though definitely to not see all this happening around. But then yes, this is something that's going to strike us very hard, looking at the social impacts and all. So very good evening to all the listeners and everyone who are there, and all to my co-panelists as well. A very good evening to all of you. And so I think I'll just start with the presentation. So we all know that COVID is a human, economic, and a social crisis, and none of the people from any race, religion, any background, ethnic background, nationality, everybody has been impacted by it, and we not necessarily have to be infected to actually to get impacted by it. So everyone across the world has been impacted by this in a very, very large way, and more would be impacted in times to come. We've been talking about these SDGs from quite a while now, and we all know that these are the global goals which were adopted by the UN member states, and we have that was in 2015, and we all know it was a universal call to end poverty and to protect the planet, and to ensure that all people enjoy peace and prosperity, and at least by 2030. But we all know that now all these SDGs have got a very kind of a bad blow, because out of these 17, 10 of these SDGs are the ones which have been directly impacted by this pandemic. And we know there'll be a collateral damage to the rest of the SDGs that are there. And so at present, all these SDGs, they appear even more ambitious than what they looked when we started with them. So obviously now we would have to all gear up to different kind of challenges that we are going to face up in the coming time. If we look at the so not just the immediate effects that health and income and jobs is going to bring about, the pandemic has brought in a fear of, I would say, a lot of uncertainty, the fear of unseen, and therefore there's an increase in people's anxiety and worry, and it is affecting their social relationships. So you could see frustration, depression, helplessness setting in into people, and their trust is getting affected as well, especially with the government and the employers, and their personal security and sense of belonging has been really impacted. So if we look at the Organization for Economic Cooperation and Development, then nearly 12% of the households, they live in crowded conditions, and this adds to the psychological strain of confinement and social distancing measures. So especially if you look at the OECD, it has roughly around 37 member states, and so it roughly covers up quite a large population of the world, and we could say that it represents quite uniformly as to what we are trying to say over here. So looking at that also, I would say the access to the basic and the exclusive sanitation is still a challenge, and is an important for limiting the spread of the virus between households. Because if you look at this, then an exclusive indoor toilet facility for one family is still a far-fetched dream for many. So when people are living in crowded places and they share the toilets and they share such facilities, then the chances of spread of the infection, they increase manyfold. Also, if we look at then across the 28 OECD countries, 36% of the people are financially insecure, meaning that they lack financial assets to keep their family above the poverty line for more than 3 months. And this is what is more important here, should their income suddenly stop. So these are people who were not below poverty line. They were very well earning and all and everything prior to COVID. So if you could say then their income was above half of median in their country. country. But now, since their income has suddenly stopped, they are slipping away below the poverty line, and for them it has become a huge challenge. And these are people generally like single parent or large families or low wage workers, or they could even be less educated, or people in precarious jobs. So these kind of people are the ones who were living at the edge, but now, since because of the COVID, they would be pushed beyond this, and they actually are a very, very vulnerable population right now. Also, if we could move to the next one, then I would say that despite the recent progress in poverty reduction, more than 2 billion people are either near or living in multi-dimensional poverty, and more than 40% of the global population do not have any social protection. So if you look at this multi-dimensional poverty, then so it's not just lack of money these poor people suffer from. So there are many other maladies that they have, like not having clean drinking water, not having good living conditions, or it could be lack of health, malnutrition. So these people are already the ones who were just already too prone to all these kind of disasters and all these kind of calamities that come in. But now they are more on the edge, I would say. Also, I would say that they lack, since they lack social protection, so they lack social assistance, they lack the social insurance, and they also lack the labor market protection that should be there. So there's lack of cash or kind transfers. They would be facing food insecurity. Then they would also, I think, require a cover which designated contingencies like these could be, covered up for these people. Also, they don't have any unemployment benefits and skill upgradation. So this is a kind of a population which has been deprived of all these things over the years, and now, since we are facing this pandemic, they are even more vulnerable to all the kind of ill effects of the pandemic, I would say. Also, the effects of such events may be damaging for people in countries which heavily depend on tourism, such as small island developing states, or inflows of remittances, or on an official development assistance. So there are certain sectors which have been hit much more than the others, and tourism is one of that. And the countries and the people who were thriving their whole soul on tourism and all, they have been really hit bad and worst hit, I would say. Then moving on, I would say then there's a large population which is being pushed below poverty line. So it's just like I just said, that they were already an unequal population, and now they have this risk of being pushed below the poverty line as well. So pushing about 40 to 60 million people into extreme poverty, and the current international poverty line stands at $1.9 per day. So they are at increased risk. Then there are 23 out of these 23 million of the people they are pushed into poverty are projected to be in the sub-Saharan Africa, and roughly around 16 million in the South Asia. So the IMF projects that in 2020, advanced economies will contract by around 6%, while the emerging markets and the developing economies will contract by 1%. So casting global poverty actually is a very difficult task, I would say, and it requires a lot of assumptions and global data. And these figures are from the World Bank. Forecast. And after 1998, the Asian financial crisis, this is the first time that the global poverty is going to increase. Now, the number of people living on less than $3.20 and $5.50 per day are also the population that would be affected. And these are the people who would be requiring aggressive, I think, assistance to actually save them. Then I would move on to increased vulnerability of poor urban population. So as the urban population across the world got impacted first and most as well, because we know that it was the international flights that brought in the infection to different countries. So they were the ones who were the hit first, and the poor urban population had many negative impacts from this pandemic. So over 1 billion people living in informal settlements, and slum-like conditions, exposed to heightened risk of infection, face job loss, direct impact on food security, shelter, and basic needs. Now, since most of these cluster of infections are in the urban slum dwellers, it led to more prolonged quarantine and cooperation with the screening teams. So, not just struggling with day-to-day flight of feeding the mouths, they were also expected to patiently cooperate with teams, and if found positive, then comply with the quarantine rules as well. So it's like very difficult for these people who are struggling with day-to-day finding food for their family, and then also kind of being met by these screening teams who ask them to do something very different from what they've been doing, and something which is not a priority in their life for that matter. And also there is an increased risk of migration for these people, because the sudden economic shock to them has made it very difficult for them to bear the expenses of lodging and living in urban setup. So I think this also highlights a very important fact over here, that the urban vulnerability mapping is something that should be really looked at by the government, so that anytime such kind of disaster happens, then things can be moved fast for these people, because where to hit, what time to hit, what place to hit. So if we have something like these vulnerable mappings for the urban sector, I think it would be really helpful for disasters to come. And we have these migrants which are further displaced. So most of these urban population, as I told you, has risk of migrating. And we have seen over these few months of pandemic, we have seen mass migration happening, especially in India as well, and also in the other countries, where people have moved back to their native places because they felt very insecure where they were, and also they were forced to move back. So if you look at it, then around UN estimates that nearly 30% of the workforce in highly affected sectors in the OECD countries is foreign born. So we already have a 30% of migrant population across the world. Also, the negative effects of job loss is significant for both internal and international migrant workers, as they often work in informal jobs and they lack safety nets in case of job loss or illness. Also, I would say that these migrants are prone to various social, psychological, and emotional trauma, especially because they have this fear of neglect by the local community. Also, they have concerns about the well-being and safety of their families waiting in their native places. Also, the families in the native places depend partially or maybe entirely on the money that is sent by the migrant earning member of the family. And the ever mounting rents and debts at the urban setup where they were, with no inflow of cash, has really brought them to a breaking point, I think. Also, I would say that scores of migrant workers tend to move back to their native places, increasing the risk of transmission for the entire population. So once these migrants, they move from the urban area to the rural area to their native area, they carry the infection with them and they increase the spread. Secondly, the magnitude of the internal migration is about 2.5 times that of the internal migration. So international migration is not much a concern right now. At present, when we are in this middle of the pandemic, the internal migration is something that we really have to be worried about, because that is what is taking the infection from one place to another. Then migration from major metro cities has given rise to a shortage of non-technical workers working in the energy industry and also in the manufacturing units. And so now, once these people have gone back to their native places, the other problem that arises now is reverse migration, which will be very critical to recovery from the economic effects of COVID-19. So as this would involve cost, it would involve logistics, and more than that, I think more essential would be to instill confidence back into these migrants and reassuring them that they should come back to work. And I think it would be a really uphill task trying to actually build back the confidence into these migrants. Then the agriculture and the food would be quite hugely impacted, because now, due to the pandemic induced income shocks, then disruption to global supply chains, and also the labor shortage that has posed quite uncertainty for this agricultural production. Also, I would say the demand side risks are mostly related with the low income countries, because their problem is that they don't have too much demand at present because of the lockdowns and the income shocks that the people have suffered. Also, the lower income populations have high propensity to adversely change the dietary intakes in response to income shocks. Because what I feel is that we are barely able to manage one square meal for the entire family. So the quality and the variety gets heavily compromised at present. And so therefore there will be high risk of malnutrition coming up in over the years. Also, I would say countries in the higher economic brackets, they are more likely to face disruptions stemming from the supply side, giving the high integration in global supply chains and the capital intensive agricultural systems, as the capital intensive agricultural systems are more exposed to disruptions, I would say, in the credit markets. So definitely that is going to get impacted, and the choice of food was going to definitely get impacted. And now coming to, I think, children who have been most impacted, I would say, during this pandemic. Though we have seen that kids have not been directly infected by COVID. Thankfully, only 1.7% of the population of the world has been infected if we look at children. But there have been many, many other effects on children due to this pandemic. And let's go through these, because I think these would be something which would be very, very important for all of us as well. So if we look at school closures, which we all know that closed. So nationwide closure of schools and universities in 192 countries. Now we are seeing some opening up of schools in certain countries, but then again, it's a very cautious approach that everyone is taking. Then a disrupted education of nearly 1.6 billion learners, or if I would say 90% of the world's student population, which is very huge. Then immediate priority is access to online classes or alternative learning, which could be television, radio. But though the digital technologies are window to the world, I would still say that there's only less than half of the households in majority of countries which have access to internet. So once we are looking at online classes and everything, this could not be something that could go on forever, or we could not say that this is something which is going to bring in a change in the life of the people or something, because half of the world does not have internet access. Also, if we look at data from 60 developing countries, then only 73% of the urban households have TV. Whereas if you look at the rural population, only 38% have TV. Also, according to the International Telecommunication Union, 53% of the world's population uses internet, and that was in 2019. And also, the distribution of internet is not uniform across the globe. So if you look at countries like Europe, then 82% would be using internet. Whereas if you look at Africa, then only 28% would be using internet. And if you go to even less developed countries, then only 19% would be using internet. So we can't depend on this kind of education giving forever, for that matter. And so this leads to a lot of access disparity for students, because some of them must be availing these online classes, but then definitely there's a large chunk of such kids who are not able to access these online classes. Then if you look at furthermore into the topic, then school closures, the presence of a positive and stimulating home environment is another important factor, because now kids are confined to their homes. So many kids find them trapped in abusive and neglectful situations during such times. Also, the prolonged absence from school is associated with lower retention and graduation rates, and so there would be an increase in dropouts now. Also, the progress towards SDG 4, which is quality education, will be reversed as a consequence And global aid and spending on education will definitely be negatively affected, because as there will be greater pressing sectors, I'm sure, so the aid would get diverted to the other sectors, and education definitely, which is a multiplier force, but yes, it would take a backseat for now, I think. Also, it took us decades of hard work and sweat, I would say, to actually build up these dropout rates, because if you look at a few decades back, then there was a lot of these dropouts. Also, there was difficulty in gender equality when it came to education, because most of the girls were dropping out, and though boys still continued. Then taking them through to graduation or vocational skills, we have really pulled in a lot of blood and sweat behind this to reach the point that we are today. But yes, we are slipping now because of this COVID. Also, if you look at, it's not just the schools, there are a lot of other factors which are affecting children today. First of all, I would say, is missing out on life-saving vaccinations and disrupted general medical care. The risk losing their lives to pneumonia. And just to tell you, pneumonia, every year we lose roughly around 8 lakh kids less than 5 years of age. So roughly around 2,000 kids a day. And now we can see as to how the pneumonia, HIV, diarrheal diseases, malaria, all this will go up because their vaccination is impacted, their other routine health services are impacted, their caregiving is affected. So in fact, it says that due to HIV service disruption, around 6,73,000 more deaths will happen by end of the next year. And this, we are talking about HIV alone. So just look at the kind of impact that COVID is having, not directly impacting the kids, but the kids who are suffering from other diseases would definitely, we'll see more mortality in that sense. Also, if we would say, then the IMR would go up, that is the infant mortality rate is expected to go up now. We have really worked hard to bring it to the level that it is today, but it would definitely even slide up back, I think. As many as 3 billion people lack hand washing facilities with soap and water. Also, 1.6 billion have facilities lacking soap or water, and 1.4 billion have no facilities at all. And we realize that hand washing is a very fundamental mechanism that protects you from COVID. But yet, we have so many children who are not, don't even have access to hand washing facilities. And we really need to look at this as to how we are going to protect these kids from the infection. And so, even UNAIDS has urged people not to divert their investments towards other side and continue with the kind of investments that they had given to such kind of health programs for kids. So that should continue, and not that people should start diverting their money to the other sides. But they've really urged that people should continue, because this is a sector which is very, very essential and crucial, because this is related to future generations. Also, then around, many children are deprived of the nutritious meals that they were getting at the school and the care programs. So now, since they're not going to the school, they have been deprived of this nutritious meals. And to tell you, there are 360 million kids who have been deprived of these school meals right now. So, and half of these are from the low and the lower middle economy sector. So these kids, which actually used to bank on the food that they used to get into the school, are not being provided these meals. So most of them, I think it is like the lifeline has been cut for them, because this is what they actually depended on. Now, next, I would say there's also increased risk of violence and broader child right crisis, which including mistreatment, gender-based violence, exploitation, then social exclusion, all that is also going to happen. And most of the child and their family welfare services at present are overstretched, or they have got disrupted completely because of the lockdowns. So the children have become really vulnerable at present. Children have been abruptly cut off from positive and supportive relationships that they rely on, which act during the time of distress, which could be their caregivers, it could be at school, their teachers over there, or in the extended family and in the community. So at present, they are really confined to the house and to the members in the house. So they don't have access to the people who could have been their stress busters, or who were the ones who actually they confided into during the times of distress. So 8 in 10 children from 1 to 14 years were subjected to some form of psychological aggression or physical punishment at home by caregivers in the past month. So just look at the data, just 2 kids have got saved, and look at it, 8 out of 10 have suffered some form of aggression or punishment in the last month. So, and it's not that we are seeing this for the first time. If we really look at public health emergencies that have happened in the past, uh, we have seen these effects happening then also. So this is something which is bound to happen. But what we need to see is that since we have seen it in the last public health emergencies, we need to have a more rigorous system and a management to see that such kind of things do not happen in future. And every time a disaster happens, these things are bound to be there. So we need to find ways to maneuver through this. So just continuing with the children that bear the brunt, I would say that if you look at the Indian helpline, they received roughly around 92,000 emergency calls for protection from abuse and violence in just 11 days of lockdown. And so there are 3/4 of children who are aged 2 to 4 worldwide who are subject to worldwide aggression and corporal punishment by caregivers at the home, which I just mentioned, and I'm just repeating the same point. So if we look at it, if we come to the women and the girls as well, then 18% of the ever partnered women and girls aged 15 to 49 have experienced physical or sexual partner violence in past few months. So there'll be increase in teenage pregnancies now, there'll be increase in human trafficking for that matter. Also, just going by the recent Ebola pandemic that happened, if you look at the data, which was during the Ebola outbreak, then in Sierra Leone, teenage pregnancy doubled to more than 14,000 just before the outbreak. So if you can look at it, all these different kind of outbreaks and pandemics, when they happen, this is what is bound to happen. This is something that we have learned from the last pandemics. So this is something that we really need to work on, because we have been seeing this from one pandemic to another. So we really need to understand that these are very important aspects of a society. Then out of the world's 13 million child refugees, those who reside in camps, they face similar challenges. And if, just to tell you that half of the world's refugee population are children, for that matter. So we can imagine what kind of impact it is having on their lives. Also, a million child asylum seekers and 17 million displaced children are among those who are most likely to be excluded from the social protection. So I would just like to add, even the drug trafficking would increase. Even I would say the organized crime and the youth gangs that are there, I think will sprung up more after this, because the kind of poverty and the other misery that this pandemic has brought, the crime rate definitely will go up as well. Coming to the next one, that is the gender equality gap, which is further widened as well. So the increased bulk of unpaid and domestic care work is done by women, and on an average they do 3 times as much as men. So definitely with this lockdown and no help available, and you're confined to your houses and no outside food as well, and nothing as well, and even the education part being taken care of by mothers at home, I think definitely they are burdened much more than the male counterparts for that matter. So the burden has really increased on them, and this would have impacts in form of mental health. What I feel that would be much more important, and we really need to look at that as well, as to how their mental well-being is at present with all these kind of different loads that is there on them. Then widespread job losses is also very essential, because this will have long-term impacts for women's economic independence and security. So there are roughly around 740 million women globally in informal employment, and these are the female who are very vulnerable right now, and many of them have already lost their jobs, and for them it become very difficult, and especially if they are a single parent, or if their wages was something which the family heavily dependent on, then it becomes a huge problem for these families as well. Then the women healthcare workers are at the forefront. We know that they are the corona warriors, and 70% of the global healthcare workforce at present is women, and so they are definitely at a high risk of infection as well. So if you look at the gender equality gap, then I think domestic violence is another thing which is very, very important and needs to be highlighted here, because these mandatory confinements have posed a great problem for these women. And so there's an increased calls all across where people have reported more and more of domestic violence. So I would say the violence against women and girls has intensified, and 60% increase in the emergency calls across globally, I would say. And then also, if you look at the UNFPA, then estimated that 31 million more domestic violent cases if the lockdown continues for 6 more months. Then so we can see as to how much of this problem is there already. And these emergency calls are coming when we know that women generally suffer, they would rather suffer than speak up. So you can imagine as the kind of calls and the number of calls that are coming in. So also there's an interrupted access to the sexual and the reproductive health services. So there are a lot of pregnant females and females who are having other kind of problems who are not able to access them, because at present the hospitals are giving priority to COVID patients. So their services have got hampered as well. So then the other section which has been really affected is the older and the disabled, who are finding it very difficult in these times, because these are the ones who actually were dependent on the others for a lot of their activities, and suddenly now because of the confinement they are finding it very difficult to do their daily routine, follow their the different things that they used to do during the day. So high risk of infection and death, that we all know that corona has really been, I would say, very unfair to the old people for that matter. And they are the ones who have we have seen the 95% of the mortality we have seen is in the older age group only. And so one, they are at a greater risk, and they are more prone to more severe disease as well. Secondly, they can experience age-based discrimination in the provision of healthcare services, and that's what we saw at Italy, Spain, and most of the countries which were grappling with a lot of patient load. For them, it became very difficult to decide to give the ventilator to an old patient or to give ventilator to a young patient. And I think some way or the other, a lot of discrimination at that point of time happened, especially if you look at countries like European countries for that matter. Then there was increased social isolation, and it worsens their well-being and health outcomes, because we heard a lot of stories where the old people were chucked out of the house, or they were not given entry, or they were not looked after, because people thought that they are the ones who are getting infected and they would infect the other members of the family. So they really went through tough times for that matter. And also the social stigmatization and the denial of support at a time, sorry, when they may be at most need of care and support. And those who are highly care dependent may become more anxious, angry, and withdrawn during the outbreak or while in isolation. Especially we have seen with people who have been in the old age homes and all and everything. It became very difficult for them because the support staff started getting infected, and they had to be pulled out of the healthcare homes. Then cleaning homes and washing hands frequently can be challenging due to physical impairments or interrupted services for these kind of people. Then I would come on to the refugees and the displaced population, which again is a huge chunk of our population for that matter. Over 70 million persons are forcibly displaced as a result of war, conflict, or persecution. And if you look at the data, then because of the lockdown, then on 10th March, when most of the lockdowns were happening across the world, International Organization for Migration recorded 5,430 restrictions imposed by 105 countries. And by 23rd March, it rose up to 33,000. So thereby limiting the freedom of movement as the borders closed. So these people were not able to move from one country to another, and they were stuck where they were. Also, 73 countries have restricted access to national asylum procedures. and 58 countries having restricted access to national registration also. Therefore, there is underrepresentation of the figures if we look at for those who were the asylum seekers, because as it is, the countries were not registering and they did not have their portals open during that time. So if we look at UNHCR, then there was a decrease by 80% in the asylum seekers. But as I said, it is deceptive because people were not able to approach these portals for that matter. So, and again, I would reiterate over here that 80% of the refugee population is children. So keep on reminding everyone on that. So because these are the people, children, I feel, are the worst brunt bearers of this entire pandemic. Since we brought in these emergency and disaster management acts, and this has happened in all the countries, so a lot of people's human rights have also been threatened. Though international human rights treaties have been working, but a lot of these yet to be implemented kind of laws are there. So there's a huge population which is vulnerable, especially with disabilities, LGBTI, refugees, displaced population, and all these people. And so for them also, we are not just testing our capacity to fight with the pandemic. What I feel is we are also testing a society's resilience and how it behaves with its members and how it behaves with its citizens is something that we really need to look at right now as well. So just the last point, that though we see all those heartwarming pictures from across the world saying that the nature is healing itself and the wildlife is healing itself, and we are locked up, but they all are now enjoying around, but I still feel it's going to stay only for a while. So as soon as we humans are going to come out of our house, they will be pushed back to the wall again. And not just that the pollution has settled for a while, but we have another kind of pollution coming up as well, and that is in the form of the medical waste that is coming up from across the world in terms of the PPEs and the different kind of gloves and masks and all these things that are being used at such a wide scale right now. So what are we thinking about disposal of these waste? It's something that we really, really need to look at right now. So I think I would like to end there, just try to summarize some of the social impacts which I see affecting most the different segments of the society which I see. So now it's for the governments actually to have very kind of inclusive programs and very rapid kind of programs where you include the government, you include the private players, you include the NGOs, and you also include the people, so as to we can get back to our life. We could all these social impacts that are there could we could actually bring down these parameters, and they would not escalate to the levels that we are seeing here or the forecast that is there. So if we could work faster, I think we would be able to achieve the goals that we had set in the SDGs. So thank you so much.